Welcome back, Awakening Beauties. I'm so happy to be with you today. And this video is going to just be about my journey having lens replacement surgery. So this process started about 6 weeks ago and it went rather fast. So here we go. Well, I just had an evaluation about getting LASIK and to see if I was a candidate. And that's why I'm wearing glasses, because I had to take my contact lenses out. And turns out I am not a candidate for LASIK because I have not only astigmatism, but I wear multifocal lenses, and I would have to have one lens for distance and one lens for reading. And the fact that I am on a computer all day long, one eye being blurry, I've been down that road before with contact lenses, and it just never was satisfactory to me to have one eye blurry and my brain trying to adjust, and it just led to headaches and just feeling uncomfortable all the time. And so that's why I have to wear very expensive contact lenses that are both multifocal and designed for people with astigmatism. Each lens is $50. It's supposed to last for a month, but it doesn't on me. My eye just tears the contact lenses to pieces, usually after a week. And so thankfully my regular eye doctor ordered me additional trials because I didn't make it. I didn't even make it a week on some of these lenses. And that is so frustrating. And it just finally got to a point where when I was recently in Kentucky, my contact lens was literally only a day old, and I didn't bring an extra one because I didn't think I would need to. And I took it out that night and I put it in the next morning. My eye felt irritated and I was like, crap, I know this feeling. And I took it out gently, and yes, indeed, it was torn. So I ended up having to wear my glasses for that entire rest of the trip, which was so frustrating to me because I really, really dislike wearing glasses. I just hate it. So I'm not, unfortunately, a good candidate for LASIK, which would have been very inexpensive for me to get done. Inexpensive as compared to what they are now advising, which is basically a lens replacement surgery where it's a little bit more involved. It's still a very quick procedure. It's basically a cataract procedure. And what they've said is that if I get this done now, I will never develop cataracts. So that would be nice not to ever have to deal with having cataract surgery when I'm older, because generally if you make it past 65 years old, you're going to develop cataracts and have to have cataract surgery. They'll reshape my eye a bit, so that will help with the astigmatism, and so that I won't be seeing double, and which sometimes I still see double with my contact lenses in. So I'm nervous but excited, and I'm going for it. I'm gonna do it. I'm scared, but I told my coworker who said that she was considering LASIK but was scared to do it. And I said, I know, I've been scared as well all these years to do it. But I said, my anger and frustration have outweighed my fear. So, yeah, so that's what's coming up. I'll keep you posted. Well, I'm here for my follow-up appointment. Let's see what they say. I should be able to schedule my surgery today. I'm excited and nervous. So just finished with my exam and scheduled my surgery. My eyes are dilated, so they're a little light sensitive. And I have to drive to work like this, which is not ideal, but yeah, I'm having my surgery next week. I'm a little nervous and anxious because I thought I would have more time to prepare myself for this surgery. But yeah, it's happening. It's happening next week. Well, it's the end of my work day. I worked from home today, and tomorrow is my surgery. I have to be there at 11:40 in the morning. I have to stop eating by 5:40 a.m., which is going to be really challenging to scarf down some food at that time. I'm feeling a little calmer about it because I found out that one of my friends, one of my teammates on my improv team, he had the same surgery done, and talking to other people who have also had it done. So I'm feeling a little calmer, a little more at ease about it, but it's still a big deal. And today I'm allowed to wear my contact lenses today. And it was such a strange feeling this morning when I was putting them in, thinking, wow, this is the last time I will be wearing contact lenses probably for the rest of my life. That's amazing. I can't even express like the feelings of happiness I have about that. So yeah, tomorrow's the day. Well, it's 5:30 in the morning and I'm making myself some breakfast because I'm not going to be able to eat again for probably more than 8 hours. So they said I had to eat by 5:40. So that's what I'm doing. I generally don't eat breakfast until late morning, like after I've been awake for like 3 or 4 hours. This is a little challenging. Better to be safe than sorry. I forgot to drink some water. And I forgot to ask if I can have any water after this. Doing good. We're on our way to drop me off so I can get my bionic eyes.
Yep.
This day has come really fast. Yay! Only half of our family is gonna wear glasses now.
Yep. Well, 1/3.
Oh yeah, Zoe doesn't wear glasses either.
She might need them, but I never asked.
Right, she's never complained about her eyesight. Well, it's almost 11 o'clock at night. I got home. Well, my surgery started at probably, I don't know what time, 1 o'clock, and was over by 1:30. It was really fast. Each eye only took about 15 minutes, and it was no pain at all, super easy. It was sort of psychedelic in a way because they gave me something like a Valium intravenously because they had to set up an IV, and but that was the scariest part, is when all of a sudden when they took me back and they started setting up the IV and blood pressure cuff and the little thing that they put on your finger to measure your oxygen levels, and they put the oxygen tube on, and it was like, I was like, now shit's getting real. It was a little bit scary. And then like lots of questions and lots of people asking you questions, and you're just having to reconfirm your information multiple times. And but then, you know, they gave me that I don't remember the name of the drug, but I was like, okay, I'm feeling good. And still feeling kind of loopy, even all these hours later. Yeah, it was fine. They did the one eye, and then they took me to the next surgery room and did the second eye, because they have to treat it as 2 surgeries. Then I was done, and so I have to wear this eye shield until I have an 8:15 appointment tomorrow morning for a follow-up. But I have to wear the eye shield at night for the next week. But I have to wear this until my appointment tomorrow morning. And yeah, everything is blurry right now. Lots of halos around lights and things. And but funny enough, 2 of the nurses there, well, I guess it's not funny seeing as it's an eye surgery center, but they both have this particular surgery. And one was just a few months ago, and the other one was like 3 years ago, and they both were very happy with their results. But they told me that I would see rings around things because until your brain adapts to that. And I can kind of already, like when I was looking at the TV earlier, just a little while ago, I was like, I could see the rings that are actually the lenses, because it has multifocals and there's like rings for each section. And they said that after a couple of weeks that goes away. Yeah, I just came home. I was really hungry, because it was close to like 2:30, 3 o'clock when we got home. And then after I ate, I just went to bed. I went to bed till almost 9 o'clock. And then I've been up for the past couple of hours, and I was just watching TV. I mean, everything is blurry, but I decided to start re-watching Outlander, because I know the story and I don't have to keep up so much with the storyline as if I was watching something brand new. So anyways, I'm really tired. It's about 11 o'clock at night, and I'm gonna go to bed because I have to get up, like I said, early for my 8 o'clock appointment tomorrow morning. So that is the update. All right, just came back from my follow-up appointment at 8 o'clock in the morning. My vision is 20/20. My left eye that's with both eyes. My left eye is still a little bit blurry, but my right eye is very clear. There's a little glare in my screen, and it's not my vision telling me there's a little glare. I cracked the screen protector on my phone the other day, so it's I'm hoping that the phone screen isn't actually cracked. I think it's just the protector, which is causing this little glare over here. But anyways, my eyes feel fine. They just feel like, maybe a little dry. I need to put lubricating drops in them. And I have no pain. My left eye is a little bit swollen, they said, still, which is probably, it's going to heal just a little bit slower than my right eye. But my left eye was the weaker eye also. So Mike took very good care of me yesterday, because I felt like I was blind all day. He had to lead me around and help me out. But yeah, overall, doing great. Anything to say?
Congratulations.
All right, that's the checkup. Now I'm going home and probably going back to bed. I have to put this spray on my eyelids twice a day. It's supposed to kill any of the mites or anything that might be living in your eyelashes, which is a lovely thought. Keep my fan handy. And I have to use these drops 4 times a day. I guess it's sort of like an antibiotic drop. This is the part that's a little uncomfortable because it does sting. It takes a moment. Oh, there it goes. There's the stinging I'm used to. Ooh. Ooh. It's like eating wasabi. It doesn't get you in the first few seconds, but then it starts. Whew. All right. 2 more to go today. So now I am 3 days out from my lens replacement surgery, and I'm doing really good. My vision is a little blurry at times, and especially like my peripheral vision, which is completely normal. But my left eye is not as blurry as it was the day after surgery. It's gotten a lot more clear, and I just feel like it's gonna get better and better over time. I've had absolutely zero pain, which has been a blessing. You know, the eye feels like, you know, there's something in the eye, but it's not terribly irritated the way your contacts can sort of be irritating. But if I could compare it to anything like that, it might be if you're feeling a little bit of discomfort from your, it's not even discomfort. I don't want to call it discomfort. It's just you can feel like a pressure at the sides of my eye, which is where they go in with the needle to extract the lens and to put the new lens in. But I've had no pain. The surgery was absolutely painless. And in fact, I felt very good during surgery because of the sedative that they gave me. And, you know, I can't wear any eye makeup right now, which is why my eyes are bare. But that's okay. Just a few more days of no eye makeup. And I will say there's only been so far one slight drawback. And this was not something I was expecting. It wasn't something I was warned about. That might be a possibility. And hopefully over time it will resolve itself, that the brain will adjust and it will resolve itself. But everything has a slight cool cast to it. It's like those movies or television shows when they put a cool blue filter, and you know, you can tell that they've used a different filter on this scene. Maybe they're showing a flashback of, you know, something from the past, and they changed the lighting and the coloring of it. So it's not as dramatic as that. Or you know how the Matrix had a green cast to it? They put like a green filter over it. Okay, so it's not as bad as that, but it is a slight blue. And I know, you know, I wasn't imagining it. So I did go online and did some research, you know, after lens replacement surgery, seeing blue, and yes, people have, that was one of the side effects, which I didn't know. My only concern, I go back to work tomorrow and I look at color all day long, which is probably why I noticed it right away, that things sort of had a blue cast to them. And I wonder how it's going to affect my ability to see color when I'm checking what we call lab dips, when we're trying to match a color standard. But the articles did say that the brain will adjust to that, and that might not be a permanent effect. And if it is a permanent effect, then I guess I just have to deal with the world being a little bit more cool toned than I'm used to. Which is very interesting. As a person who, I pride myself on seeing color very well. And it's something that I do very well in my job. So, you know, we'll see. We'll see if it affects any of that and how I'm seeing color at work. And, you know, I'm just going to deal with it. But I can tell you, I am very happy with the results so far. I feel like it's just going to keep getting better and better as my eyes heal. And yeah, I'm really happy about it. And I am a person who does not like to go to doctors. In fact, I need to make a well woman visit. I need to make a yearly visit. I haven't been to a, it's been a while since I've been to a doctor. So I don't like doctors. I don't like medication. I try to handle things very naturally. And I certainly am not a person that wants to ever go under the knife, but this was so easy. And it's like I have said before, when my fear of the surgery and having them poke into my eye became outweighed by the frustration that I was feeling and the money that I was spending on contact lenses and glasses. So I have no regrets. I'm really happy right now with the results.
and can tell you that for a person like me to go through this process, that just about anybody, I think, could do this. In fact, a lot of people do end up doing it when they get a little older and they get cataracts, and that's basically what this surgery is cataract surgery. So yay for me, I'm never going to develop cataracts. Well, I hope you've enjoyed watching my journey through this process. I hope it's been informative enough that if you're considering it, that you will, at least maybe it'll put your mind at ease a little bit more, this process and how really easy it was for me. And not that it would be the exact same for every single person, but maybe it's answered some questions, and maybe if you're considering this surgery, makes you feel a little bit more relaxed about the process. And if you have any questions, please feel free to leave them below, and I'll do my best to answer them. But until next time, I'm doing great. And you know what? You're doing great.